Well, hello. Thank you for joining me today. I've got a very special guest, Dr. Felice Gersh, to talk about a topic that more and more people are finding is an issue for them, and that's hormones. Now, what we do about it and what the research is telling us. Dr. Gersh, thank you for joining me today.
Oh, my pleasure. It's one of my favorite topics.
It really is. And we were just talking about it before we went on. It's only just popped up kind of recently. And really, there's probably not a lot of many other docs talking about hormones. Can you take us back to when you first, started to think about, hormones in your patients?
Well, the really big jolt came when the Women's Health Initiative, because I'm an OB-GYN. So, of course, I deal with women through all the different stages of their reproductive life and then on into the menopause. And I was a firm believer that women after menopause would benefit from having hormones since nature took away their hormones. But with that, I could see just through my own observation, I could see all the harms that happen to women as their hormones started dropping and then were completely gone from their ovaries. And so I was a firm believer in giving what was called hormone replacement therapy, HRT. And then when the Women's Health Initiative came to an abrupt halt and they stopped it, and then all of this information or misinformation became prevalent that hormones were actually, surprise, really evil. It's like, and I knew that made no sense, no logical scientific sense at all. So I would try so hard to persuade my patients to stay on hormones, but there was so much negativity at that time, and they were so frightened. And I was going against the big guys, the FDA and the big medical societies. And like, who was I to say what they were doing was wrong, And it's like, but it makes no sense. And look what they were using. And I wasn't the only voice, but we were very small compared to the big voices shouting down hormones. But that's when I knew that I had to go out and start talking more. And initially, it was really just with my patients, and I would do group meetings and evening programs. And then as time passed, it was like, no, I'm going to do more out in the world, like talking to you and getting on podcasts and writing, and then doing articles to get published in mainstream journals, because this has to stop, this sort of rampant hatred and fear of hormones. We just got to put an end to it.
You really put it very well, because, as a dental practitioner, I've been very disconnected from, the idea of hormones at all, until, very recently trying to integrate functional medicine into practice. But so would you say that it was intuition that kind of took you there? Like you just didn't feel it was right?
Well, I believe very powerfully in the power of observation. So I've been practicing for several decades. And I know that nowadays it's like everything has to be a placebo controlled, double blinded study. And that's really what big pharma needs in order to get a drug approved. But most all of the big inventions and discoveries through the history of mankind have not been done that way. They've been through the powers of observation. So as I had patients of every age, and I could see, like here's what a woman looks like at age 20 and 30, 40, 50. And I saw what happens as they transferred their ovaries from functioning into non-functioning. And I saw what happened to their body, to their shape, as their bodies literally morphed in front of them. And they would come to me and say, what on earth is happening to me? I'm trying to do the right thing and I'm losing my cute little waistline. And look at this belly. And I can't sleep at night. And they had so many symptoms. And it was like the powers of observation spoke to me. Aging is not just about years. It's about deficiencies. And one of the big ones is the deficiency of hormones, because what I saw was that a woman could go through menopause at 42 or 57, and it's whenever she lost her hormones. That's kind of when the ticking started in terms of the time bomb for aging. And it wasn't just about number of years, it was about deficiencies of hormones. And then as I started reading, and I became a constant fan of PubMed and Google Scholar. And I would read all the different publications, everything peer-reviewed articles. And so I looked at the science. And I had to actually go back and learn and relearn things that I'd either forgotten or didn't exist when I went to medical school about cellular biology and physiology and all of these different pathways. And I had to self-teach all of what goes on in the body and what hormones are doing, because it all started with my powers of observation. And then I had to learn, because to me, it's very important to understand mechanisms. Like, it's not just, associations. I want to know what is going on. And so then I could explain, like, without hormones, this problem happens, and this is why. And of course, the more I learned, the more I was in awe of what hormones do in the body and the complexity, and how, as an OB-GYN, I was absolutely taught nothing about what hormones really do. All I was taught about so-called sex hormones, and that's what they were labeled, like it was only about sexual function, reproduction, because isn't that what an OB-GYN is all about, just reproduction, without thinking about how does it link to the rest of the body, and how is reproduction an aspect of all of metabolic functioning. So I had to go back and rediscover and how everything works and learn things I never learned. And I became what I have labeled a synthesizer. So I read across all fields, and then I put it together to create a cohesive view of what is the female body, what does it need to be optimally healthy throughout all the different decades. And so that sort of became my mission. And so fundamentally, it was just by living my life and seeing what was happening to my patients, sort of the very old-fashioned way of learning.
Almost like you were born to do the work, Dr. Gersh. It's
maybe my destiny.
It's a fascinating story, and it kind of culminates in a recent article you posted. You had published, in the British Medical Journal, and this is a pretty serious, paper in the turning point of the perceptions of HRT. I want to dive into kind of some of the mechanisms a bit later, but can you describe to us the symptoms that your patients are experiencing in terms of the different age groups? What are they experiencing, and how has it changed? Because, like, for instance, I had not heard of Pcos, probably 10 or 15 years ago, but how is this, changing in your patient groups?
Oh, well, when it comes to Pcos, also known as Polycystic Ovary Syndrome, PCOS, it is accelerating in terms of its prevalence and its severity as well. So that's one of my specialties. And I make the connection between what happens for women who are younger, reproductive age women, are the ones who are discovered and diagnosed with this problem, although it is a lifelong problem. The symptoms change, but the underlying mechanisms don't go away when women go through menopause, but they kind of disappear in some ways, but other metabolic issues become more prevalent. But in terms of the connection between what menopausal women experience with their metabolic symptoms and dysfunctions are very similar when you look at women with Pcos. And that's because they have an underlying connectivity, which is estrogen deficiency. And it's really amazing when you look at, well, what are some of the metabolic problems? If you leave out the androgen excess, because that is unique to this particular reproductive age issue, with polycystic ovary syndrome, is the androgen excess, and the irregular cycles. But if you take all of that part out and you just look at the metabolic, and of course, included in metabolic is all cardiovascular and the brain functions, neurological, every kind of function in the body is what goes under metabolic, because it's about the creation, distribution, storage of energy, what I call the spark of life. So if we look at the comparisons between the two, you see that they're really the same. Women with both conditions, whether it's transitioning into the menopause and thereafter, or polycystic ovary syndrome, have higher rates of insulin resistance, prediabetes, diabetes, hypertension, vascular issues like the carotid intima and all the arteries. Their intima lining becomes inflamed and thickened. And there are issues through the brain in terms of higher incidence of sleep disordered breathing, sleep apnea, insomnia, and also mood disorders, higher rates of anxiety and depression, irritable bowel syndrome, autoimmune diseases like Hashimoto's are higher in both groups of women. And, all of the issues involving fatty liver is higher in both. So you can see across all the different organ systems that there are metabolic issues that are similar. And so in thinking about it, okay, so what's the common thread? It's a reduction in estrogen for totally different reasons. In menopause, you don't have production of estradiol, the dominant estrogen produced by the ovaries, any longer because the ovaries go through their aging process and then become non-functional in that regard. In women with PCOS, they don't go to a state of no estrogen production from their ovaries. What they have is lowered estrogen production because of sort of a genetic dysfunction that becomes magnified in terms of their conversion of testosterone into estradiol in the ovary through the action of the enzyme aromatase. It's not properly functioning, and that also relates to the issues in terms of stimulation from the hypothalamus and the pituitary, which puts out the signals that tell the ovaries what to do. Of course, those are a little bit or a lot in disarray as well. So it's a complex issue, but the end result is that women with PCOS are not producing enough estradiol, and women in menopause don't make any after they get to the end of the road with their ovarian function. And so you get this complex array of metabolic dysfunctions. And the reason, of course, is because estrogen is like the glue that links all of the organs together in terms of their synergistic timing, their circadian rhythm function, and there are estrogen receptors through every organ system in the body to enable every reproductive age woman to be healthy so that she can actually support the process of reproduction. And that is just not recognized, that all of this links together in this beautiful whole when a woman is functioning properly and has optimal hormones that are balanced and in the right order, the right rhythms, and so on.
Dr. Gersh, you speak so much sense. When you put this whole picture together, I'm just picturing, I remember reading a paper about HRT and gum disease, and, it was kind of a, the idea that gum disease is mediated by hormones. It was a very kind of foreign concept to me at first, and so it led me into understanding the bacterial connection to hormones and the collagen connection. And so, hormones teach us so much about the body, and you can see that's how they've taught you. Can you give people a little bit of a rundown on the hormones that you're mentioning? How estrogen, for instance, is synthesized for the ovaries, and just a rundown on the things you test and female hormones in general.
Well, and we definitely have to come back to the mouth, because I actually talk about that, and the mouth is so critical. And I just have to put in a little bit of a word here about what happens in medical school. We were taught nothing about the mouth. I mean, people who go into ear, nose, throat, ENT, they obviously do learn more. But in terms of general education, what are we told? Well, that's the province of the dentist. You don't need to know. It's like, this is such a fallacy of conventional medical education and approach, is looking at different parts of the body and different organ systems in a totally disconnected way. And of course, that's the opposite of the way I look at the whole body. It's like one body, one set of hormones that are traveling throughout the body, that when they're made from the ovary or an endocrine organ, and also hormones are made on site in organs, and that is called paracrine. And even within cells, that's intracrine. So if we look at estrogen, so I hope every male out there will say, I love estrogen, particularly in the form of estradiol, because men don't really realize this, but they have tons of estrogen in their body, but it's not circulating. It's made on site from conversion of androgens like testosterone. In fact, the enzyme that converts testosterone into estradiol exists in artery walls, and that is so key. So it's so important for men to embrace estrogen too. It's just that it better not be circulating, but it's definitely produced on site. So, but women are different than men. And so I talk about that all the time, how different we are. Even when we have comparable structures, they actually work quite differently in many respects. That's why women their pathway into heart failure is different. Cardiac events like heart attacks can be quite different in males and females, and pharmaceuticals can work differently in males and females. Our immune systems are so different, and it's predicated on two fundamental differences. One is our hormones, and two is our genetics, because we women have the two X chromosomes, which give us a little immune edge, because one of our deactivated X chromosomes is not completely deactivated, and it actually has a lot of immune functioning genes. And when we're little embryos, the two X chromosomes are still working. So we are very different, and recognizing that helps to set the stage for honoring the differences and recognizing that women are different than men, and their cardiovascular systems need a different approach, because the hormones really, along with the genetics, create a different environment. And so in terms of the fundamentals, we women have ovaries, and all estrogen in the ovaries is produced from testosterone. It's a universal thing. You don't have estrogen in the ovary coming from anything but testosterone. And testosterone is converted with this enzyme called aromatase into estradiol. And the pituitary, after its stimulation from little factors that come from the hypothalamus of the brain, produces the gonadotropins, luteinizing hormone, and FSH, follicle stimulating hormone. And as the ovaries produce less and less of the estrogen in the menopausal years and the years preceding it, because this is a process, it's not a one moment in time event, it's a process. The gonadotropins, the LH and FSH levels start to rise. But initially the ovaries can compensate, but eventually they run out of eggs, okay? And then when all the eggs are gone, then you just can't make any more estradiol, but you can still make testosterone. So the ovaries are still metabolically and hormonally functioning all the way at least past 65. And probably for the entire life of the woman, a little bit of testosterone is continued to be made from ovaries. And because of that, the ovaries, now we understand, are important even after menopause for maintaining health in the woman. In fact, cardiovascular events are higher in women who have their ovaries removed before the age of 65, even if they're in full-blown menopause. So this is actually some new understanding of the ovaries, because as an OB-GYN, I fought against this. In the very beginning, even when I was in training, I was thinking, like, why would you remove the ovaries if you have to do a hysterectomy, which is removing the uterus, just because they're in the neighborhood? I mean, like, do we do that with other organs? Do we just take out our organs because we're in the neighborhood? Well, we were taught when I was back in training that, well, a woman's going to go through menopause, so what the heck, she might as well have her ovaries removed. And starting from age 40, it was appropriate to remove women's ovaries if you did a hysterectomy for completely benign reasons. Sometimes, like, not for good reasons, because we know that hysterectomies were done often inappropriately, unfortunately, probably still happens to a large degree when it really doesn't need to happen. But at age 45 and beyond, it was considered standard of care to just remove the ovaries, even if a woman was still having regular cycles, she wasn't in menopause, because, oh, well, she's going to go in menopause anyway. So between 40, 45 was gray zone, sort of optional. 45 plus, you should just take them out. Because, well, you never know, you might get ovarian cancer. Well, that's true, but we don't just take out organs because someday they might turn cancerous. And fortunately, ovarian cancer is considered in the rare cancer category. It's not a good thing, as it often can be fatal, but we don't just remove organs prophylactically because something could go wrong. And now we know that it's really harmful to remove ovaries because they are still making testosterone. And testosterone has its own receptors throughout the body. It's very important for brain function, bone, muscle, all kinds of things. And of course, it's also converted into estradiol in many tissues because the organs of females can also convert testosterone into estradiol. We just have so much less testosterone that we can't make up the difference. Like after menopause, a man's brain has 6 to 8 times more estradiol in it than a woman's brain, because he has all that testosterone still that he can make the estradiol in his brain. So brains can make estradiol. In fact, they make plenty of it. But women's brains in the reproductive years, they have plenty of estrogen in their brain, but it's all coming predominantly from their ovaries. But after menopause, they don't have enough precursor to make enough estradiol. So their estradiol levels in their brains drops tremendously, but men can still make it. That's why women have almost 3 times the incidence of Alzheimer's disease compared to men. And as well, because vascular health is so important, and we know that maintaining the health of the blood-brain barrier requires healthy arteries that stay intact, and that starts to change also. So the blood-brain barrier can break down and allow environmental toxicants, body waste, and so on to go into the brain itself. It's not a barrier anymore. It's like leaky, so all our barriers become leaky. And so we get more toxins, more biotoxins, chemical toxicants in the brain. And the immune system is controlled by estradiol as well. So you have a dysfunctional immune system in the brain that doesn't control and creates more inflammation. After menopause, all women develop a low-grade state of chronic inflammation. That's why they call aging inflammaging, right? So all of this is happening, and it's happening in every organ. I just mentioned the brain, but you could then talk about the bones, the joints, the heart. So this is happening throughout the female body, and it doesn't get the respect that it deserves. Instead, the conventional medical world, instead of saying, well, why don't we recognize that all these things are happening and give women hormones? No, it was, why don't we just wait and we'll do something as each organ system starts to have a serious problem. So like, oh, your joints are falling apart. We'll just give you a new knee, a new hip, right? Or, now your blood vessels are no good. We'll put you on several different blood pressure drugs, and, what we'll put in stents that don't really help, or things of that sort. And on and on, well, when your bones are looking like they're breaking or they have broken, we'll put you on a drug like a bisphosphonate or some other drug that actually prevents healthy bone because it changes how the bone actually turns over and heals itself. So there's so many problems with so many pharmaceuticals, and there's no exit strategy, and there's a lot of long-term harm. So we know that women are going to face all these issues. Why not be proactive and give hormones? And that is why I'm on a mission to educate, so that instead of dealing with all the problems that keep popping up like playing whack-a-mole, right, we're going to be proactive and realize that all these myriad issues that are called aging are really due to deficiencies as women transfer their body status from pre into post-menopausal states.
You speak so much sense, Dr. Gersh. It is just so refreshing to see someone putting a big picture like that. And it's a really big picture, isn't it? Hormones really tell us such a fascinating story. I think, look, can you just explain to us a little bit about the estrogen and progesterone relationship, what they do in the female body, and what does testosterone do?
Well, they all have receptors throughout the entire body and all the different organ systems. So in terms of if we look at the uterine lining, okay, that's where we started as OB-GYNs, estrogen is about growth and proliferation and healing. So a lot of people have no idea that estrogen is really key to the initiation of the inflammatory response, and then the initiation of the resolution to inflammation response. So estrogen is involved in platelet function, all the innate and adaptive immune cell functions. So it actually triggers the production of many of the growth factors that create brain growth factors and tissue growth factors that allow healing. In fact, the skin can make estrogen too. But it makes less as you age. That's why healing is much faster and better in younger people than in old people. That's why so many old people have chronic wounds. That's why they have these proliferation of wound centers, and they're usually older people, obviously, that are in wound care centers trying to heal because their tissues don't heal well. And estrogen is very key to the whole process of, dealing with invading pathogens and in creating inflammation to kill off the pathogens and then dealing with resolution. We know that with the COVID pandemic, that statistically women do better because we have a more robust immune system, and estrogen is really key to all these things. In the uterine lining, estrogen causes growth of the uterine lining, but we don't want uncontrolled growth. Uncontrolled proliferation is not what we want. So the body is like, the Chinese got it so right with their yin yang, that everything is push pull, hot, cold, everything is in balance. So progesterone is, if you think of the estrogen as like the gas pedal, then progesterone is kind of like the brakes. So in the uterine lining, we see the estrogen causing growth, or we call proliferation of the lining. And then when you ovulate, you have the production of progesterone, which transforms the lining into secretory. So it's like a tree that's growing, 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 and then suddenly it stops growing, puts out branches, leaves, and flowers. That's kind of like what progesterone does. Otherwise, you just have uncontrolled growth. It just gets taller and taller. But this is what is happening. The progesterone stops the growth and causes it to like flower, okay? And that is what will allow the proper environment for a fertilized egg to be able to enter and then implant in the uterine lining. So that's what, in the uterus, that's what is happening with the progesterone. Now, throughout the body, there are these both synergies and also balancing with estrogen and progesterone. So in the brain, if you have like a reproductive age woman, for example, who has traumatic brain injury, she will do better than a male. She will actually do really well. And progesterone and estrogen in the form of estradiol, no other form, just estradiol, are actually neuroprotective and help to promote the growth and regeneration of neurons, control the immune system from being out of control, because we don't want out of control inflammation. And estrogen and progesterone together help to maintain a beautiful balance. And so in terms of the brain, there's been some data that if you have too much of one or the other, you can actually have these imbalances that can give you more, we'll say, anxiety, and mood problems. So if we look at this whole new system that we've discovered, it's really interesting to see how the two work together. And that's called the endocannabinoid system. So the endocannabinoid system is a lipid signaling system. So in our bodies, we have different signaling agents. Some are made of amino acids, and those are called peptides. So they're like tiny little chains of amino acids that are smaller than what would be called a hormone. So it's a shorter chain of amino acids. And then we have lipid signaling agents made out of fatty acids that actually control the induction of inflammation and also the resolution of inflammation. And they have receptors for the endocannabinoid system throughout the body, but particularly there's a lot in the brain and on the immune system cells. So it turns out that estrogen, very few people know this, estrogen promotes the production of the endocannabinoids that help to calm the brain and make us feel happy and peaceful. One of them is called anandamide. And estrogen promotes the production and also blocks the breakdown. So our brains make more of this endocannabinoid. Now, for people who wonder, like, what are these? Well, we know everyone's heard of cannabis, right, from hemp or marijuana. So they actually named the endocannabinoid system actually after cannabis. It was sort of reverse engineering. They discovered that cannabis had an effect on the brain before they discovered the mechanism. But once they discovered it was through binding to our own receptors, through our own signaling agents called the endocannabinoids, they named our system after cannabis. So they call it endo for within us and cannabinoid for like cannabis. But this is what plants can do. It's like the miracle of plants, that they can sometimes bind to our own receptors. So it's this plant can bind, but our body has its own system. So separate from cannabis, totally. This is our system that keeps us happy and calm. It also keeps our immune system working properly. And all of that is mediated through hormones, estrogen and progesterone. So it turns out that like everything in the body, it somehow relates to reproduction, but these systems are throughout the body. Well, within the reproductive tissues of the female body are the endocannabinoid system. So, and it's very critical for reproductive success. So during the early phase of the menstrual cycle, the proliferative phase, estrogen is being produced, estradiol, and as estrogen levels rise, so too does the production of the endocannabinoids, particularly anandamide. And then the highest spike of our endocannabinoid is when the estrogen spikes, that initiates ovulation. But then it turns out that when you have really high levels of estrogen, it actually causes a downregulation of the production. And then what happens is the endocannabinoids downregulate estrogen. We have a drop. And then it turns out progesterone actually diminishes the production of the endocannabinoid. So it's this incredible balance that's critical for reproduction. But of course, when things are imbalanced, that's how women can end up with PMS and mood disorders and so on. A lot of this is mediated through the endocannabinoid system. So progesterone balances estrogen. So estrogen causes an increase in the endocannabinoids, and progesterone causes a decrease. But the way nature made it is that we'd always be perfectly balanced. But when things get out of balance, that's when you can have all kinds of mood disorders. But it's beautiful when everything is just right. Nature made it just right. And like I mentioned, all of the immune cells have receptors for these hormones and also for the endocannabinoids. So it's all a beautiful balance. And this can be replicated throughout every organ system in the body. And testosterone, which declines with age, but separately from the actual menopause. That's why testosterone is still produced well after menopause. It keeps on being produced. That's why the ovaries are still valuable functioning organs, even after menopause has completely completed and there's no more estrogen or progesterone being produced. There's still testosterone being produced from the ovaries. So testosterone, by the age of 40, the average woman will have only half the amount of testosterone that she had at age 20, which is nature's plan, because a lot of testosterone also is involved with libido and sexual function. So nature doesn't want women post 40 having babies much anymore, or being attracted to males, or vice versa. But we humans don't care what nature intended for us. So that's why we play around with it and we give hormones so that the cells don't know how old we are. Only we know how old we are. So if we give the cells the hormones and the nutrients that it is, programmed to receive, the cells will still do the same things that they were genetically programmed for. So that's kind of like my approach to healthy aging is know what cells need and give it to them so that they'll perform the way we want them to, like as if we were 25, for as long as we can. Of course, we can't quite do that, but we can come as close as we can. But testosterone does definitely decline in women with age, but it still is around being produced. And half the testosterone in the female body also comes from the adrenal gland. So that also is helping to maintain our testosterone. And it's very important for brain function, for our bones. In fact, women with polycystic ovary syndrome, when they existed with this problem, because it's a little genetic variation, but before our modern society took over and started changing our diets and our circadian rhythm because of light at night and all these other things that have come, and the endocrine disruptors, the chemicals that have taken what is a minor problem and turned it into a really gigantic problem. What women had when they were in ancient times with this little extra testosterone production is they were like the leaders of their tribe. They were maybe a little bit braver, bolder, more outgoing. And in fact, they did a study of women who were Olympic gold medalists and found that they also naturally made little higher levels of testosterone than the average woman. They were like the normal PCOS variant. So I always tell my PCOS patients that you were destined to be the leaders. We just have to go back and put things back in order so that you can have the destiny you were designed to have in nature. And so all of these hormones work together. And when you don't have one or the other, there are going to be all kinds of issues with the body. Estrogen, when in balance with all the hormones, I am convinced, I don't have the proof, but I know the science. So I am convinced, and I just wish we could get the studies, that if we can maintain the balance of hormones to be reasonably physiologic, as women age, and we keep this chronic state of low-grade inflammation, this inflammaging from happening, that we can dramatically reduce not just the cardiovascular problems, the neurological problems, like the cognitive problems, the mood problems, the bone problems, the joint problems, but I believe also the cancer, that we will find less breast cancer, less colon cancer. In fact, even the stupid Women's Health Initiative study showed less colon cancer in women who were on the we'll say not human identical hormones that were used in that study. Even they had less colon cancer. But I think that it will really be shown that when you keep the balance, you'll actually have less breast cancer. In fact, we know that estrogen actually activates certain tumor suppressor genes and also works on the genes that keep cellular cohesion. So that means like that cells won't break apart. That's what metastatic cancer is. The cells are breaking off and then traveling through the body, either through the lymphatic system or through the vascular system to distant sites where they implant and grow and create metastatic disease. But estrogen helps to keep the cells from doing that. It helps to keep them from breaking apart and then traveling throughout the body, creating what would be, of course, a deadly disease. So I am convinced we just have to get the data, but the science is there. We know that estrogen in the form of estradiol does regulate tumor suppressor genes, that when you have the beautiful rhythm of the estrogen and progesterone also can activate tumor suppressor genes and like P53 and so on. So when you have the beautiful balance of hormones, you actually lower risk of cancer as well as every other thing that goes wrong as we age.
It's just amazing how far-reaching it is in the body. The osteoporosis connection is really interesting, and strong link there to gum disease as well. And
yes,
when
absolutely.
and we'll jump into that. But when I read your paper in the BMJ, it just made me think of the gum disease, heart disease connection, and that it hasn't really been well defined as to why there is a connection there. But then it seems like this is a big underlying part that these imbalances and, as you say, deficiencies in hormones really are contributing. It's just fascinating. Dr. Gersh, can you just describe a typical patient who suspects or thinks they have Pcos, what they're experiencing and what you're testing for in your clinic?
Well, the classic way to diagnose, and this was by a committee of doctors, is you need two of the following three. And this was somewhat controversial because I personally and many others believe that it should include androgen excess. But you need two of the following three. Androgen excess, which means an excessive amount of either from the adrenal or from the ovaries, DHEAS or testosterone or other androgens. You need to have higher than normal levels, or clinical manifestations like facial hair. So a poor woman has to shave every morning, has, terrible alopecia, like the female version of male pattern baldness. And cystic acne, although it's very prevalent in women with PCOS, is not actually part of the definition, but that's, also controversial. And the other is menstrual irregularity. And then the last one is an ovarian look of PCOS, where they have lots and lots of little follicle cysts that are on the outside rim of the ovary, called the cortex, on an ultrasound view of the ovaries. So you need two of those three. So it's either androgen excess, irregular cycles, and or ovarian hyperproduction of these little cysts, so polycystic ovaries on ultrasound. So that's really straightforward. You'd think it's so straightforward that every woman would get diagnosed like really easily, but there's actually been studies saying that women have to go to like 11 different doctors before they get the correct diagnosis, which seems bizarre when you know how simple it is to make the diagnosis.
Why do you think that is? Do you think that's because there's a lack of appreciation for the condition, or?
I think it's a combination of the fact that women can go to one of several different doctors initially in order to get treatment for their condition. So if they go to a dermatologist, the dermatologist may say, okay, well, I'm going to treat your acne, or I'm going to try to do something for your hair loss or your facial hair, and not really put the whole thing together. If they go to an endocrinologist because they can't lose weight and maybe they are diagnosed with insulin resistance or prediabetes, women with PCOS have 7 times higher incidence of developing diabetes by age 40 than the average woman. So they could end up easily in an endocrinologist. But they also have emotional problems, very high rates of anxiety, depression, and gut problems, irritable bowel syndrome, joint problems. They could end up in a rheumatologist, a gastroenterologist, a psychiatrist, and of course, irregular cycles. And sometimes when they just go to the gynecologist and they have irregular cycles, they're just immediately just put on birth control pills. So they're not really doing much of a workup. They just say, oh, irregular cycles, we'll put you on birth control pills. And so it can be very disjointed care, and nobody is taking the time. Maybe they're not given the time, or they don't even have the interest to really sit down and go through the entire array because of the symptoms. Because so often when patients go to doctors these days, they're asked, what's your chief complaint? Like you get one chief complaint. So the patient has to say, well, okay, one chief complaint, I have irregular cycles. Okay, one chief complaint, I have hair loss. One is I have, anxiety or insomnia. I mean, so they're only given one chief complaint. Nobody takes a full history. So it sort of is astounding. I'm just trying to figure it out myself because it's the most common endocrine disorder of women. It's like you'd think everybody would know about it by now. I mean, only number 1 on the hit list. So I think everybody should know. And I have patients that figured it out themselves, as I did myself. It's like, oh, I figured this out. I went and listened to a podcast, and now I know what I have finally. But the problem is once they get the diagnosis, which can be a journey in itself, they don't get much of a treatment. They're put on the same stuff from like 30 years ago. Like, here's your birth control pills, your spironolactone, and your metformin. Now, not that everything is evil about them, but number 1, birth control pills are really inappropriate because they create metabolic dysfunction. That's what they are doing. They're endocrine disruptors designed to interfere with normal ovarian functioning. Now, these women don't have normal ovarian functioning, but this is not fixing it. So it drives me crazy when I hear patients being told that the doctor said, we're going to balance your hormones and regulate your cycles. It's like, there's no balancing. These are not cycles. This is endocrine disruptor being given. And then when you withdraw it, you get withdrawal bleeding. So there's nothing physiologic. You're not regulating anything. You're not fixing anything. You may suppress some symptoms. So, kudos to that. I can't argue that it's nice to suppress some symptoms sometimes, but it's better not to do it by creating more problems. And birth control pills increase clotting propensity, which women with PCOS already have. They increase vascular disease, leaky gut. They alter the gut microbiome. They have an association with more anxiety, and in younger women with higher suicide rates. I don't think this is the right choice, and it certainly isn't getting to the underlying root problems that are going on in the woman. So I think it's time to say this is not too big to fail. Birth control pills have been given since 60 years now. It's been whatever it is for a long time, and it's time to just be truthful. These were designed before we even knew about what estrogen and progesterone and testosterone did in the female body. We have to rethink this. And that's, what I do as a synthesizer. It's like nothing is too big to fail. Nothing is off grounds to be discussed. Everything is open to challenge and reinvention. So we need to say, we now know so much more about what is going on in these women. We need to take an approach that is different. And so that's what, I'm trying to bring to light, is that there are ways, both using foundational lifestyle changes, which are key, and then occasionally short-term pharmaceuticals, but certainly not permanent. We always have to have an exit strategy, because pharmaceuticals, when they're used, should be a bridge to health. I can't say 100%, but in a large percentage of cases, we know that we can reverse prediabetes and diabetes when they've done comparators looking at lifestyle and exercise and so forth, and metformin in people not with Pcos, but with just gestational, diabetes from whatever the underlying cause, that lifestyle wins. So why are we using the drug that has potential harms, when we have lifestyle? Well, what I always hear from doctors is patients won't do anything. They won't change. I refuse to believe that. I refuse to believe that patients will not change their behaviors and would rather become ill and suffer the consequences. That makes no sense. I think it's lack of education and support, to help people to make the changes that they need to make, and recognizing when people become addicted. We now have screen addiction. I know people that they can't separate from their cell phone. They have anxiety, cell phone displacement anxiety. It's like, where's my cell phone? They need to have it with them, or they need to have that sugar fix, or they need to, watch television all the time, or whatever it is. We have addictions of all kinds. And people need to understand that we can change these addictions by changing brain function, by changing diet. I mean, I just read a fascinating article that showed people who ate a really healthy big breakfast, that they did functional imaging of the brain, and they looked at the frontal lobes and the amygdala, and the amygdala is like the center of the brain that's involved in impulsivity and anger and so on, and the frontal lobes involved in like thought and focus and cognition. That's why when they do studies of children who have breakfast, they find that they do better in school. Well, it turns out that functional imaging of the brain shows that yes, and this is in adults, that their brains work better, they're calmer, they can be more focused and less impulsive in terms of their eating choices and other choices when they eat a big healthy breakfast, which is critically important for women, for everyone, but particularly women with PCOS, polycystic ovary syndrome, and women in menopause, because that helps to set their metabolism back in order and their circadian rhythm back in order, which is disrupted in both groups of women. It's like both groups of women are living a world of jet lag. Well, we all know that jet lag is not good for your health. And that's what happens when you don't have enough estrogen for whatever the reason, including if your body is filled with endocrine disruptors, chemicals that are estrogen mimics that actually disrupt the way estrogen normally functions, which is a huge problem today in our plastic world and chemical world, that it creates a disruption of the normal rhythms of the body. The circadian clocks become all off balance. The master clock in the brain is really critically important to function for every organ so that they work together in synergy in the same time zone. And estrogen is critically important. The receptors in the master clock in the brain for estrogen. Without proper amounts of estrogen, it's basically putting that human into a state of jet lag. So, and then they can't sleep. They want to sleep late and go to bed late, and they're more energized and more hungry at night. Like everything is wrong. They have no appetite in the morning and they're starving at night. And that's a sure sign of circadian rhythm dysfunction. And these are very, very prevalent and treatable, but not spontaneous resolution. And that's why you have to work on it. And I think when people understand what's happening in their bodies, they're willing to go and change. I really believe that because I see it in my own practice. So I think that we should never do the fallback of just giving people polypharmacy, the poly pills and the multi-drugs regimens that so many people are now on is not really the ultimate solution to what's going on.
Dr. Gersh, I want to just dive into your approaches at the end, but before we do, I have to ask the question, can you describe the connection to gum disease between hormone imbalances
Yeah.
and the mechanisms there between the oral microbiome? Because I'm really looking forward to hearing it from you.
Well, we know that women in menopause and women with polycystic ovary syndrome, because this has been studied, they have altered dysbiotic, so abnormal oral microbiomes. Unfortunately, so do many people who don't have those problems. And it's a very, very prevalent problem throughout our society. And we now understand that the mouth is part of the entire GI tract. And in the mouth, there are bacteria that have certain enzymes, because all of our microbes work in synergy. Our good guys work in synergy to help our bodies to function properly. So for example, the healthy, normal microbiome in the mouth, they make a type of enzyme called reductases. And when we eat wonderful, healthy vegetables that are green leafy and beetroots and so on, that are filled with nitrates, it's through the action of these enzymes, these reductases that come from the bacteria that convert the nitrates into nitrites. And the nitrites are converted later down in the GI tract, in the stomach and further south by action, but you have to have adequate stomach acid, which decreases with age, and women after menopause have less stomach acid, which creates more GERD, more acid reflux happens in women after menopause than in men, age by age. And you need to have all the right nutrients like zinc and magnesium, B12, and so on, to create this enzyme reaction to convert nitrites into nitric oxide. And nitric oxide is a gas signaling agent and antioxidant that is critical for the functioning of everything in the body. So this is so critical that we have the right microbiome in the mouth for the health of every organ system in the body. And in the mouth itself, when you don't have the right microbes, you end up with the gingivitis. So it turns out that the good microbes, which we call commensals, actually make toxins that kill, like these different enzyme systems and such, that are like our own immune cells, our white cells, like our macrophages, that can put out enzymes to kill pathogens. So if we think of our own single-celled white blood cells kind of as cousins of the bacteria, which are single-celled creatures, they have a lot in common. They can create enzymes that can kill other pathogens, other bacteria, and also then phagocytize, so they can gobble them up and get rid of them. So there's like this ongoing war that's always going on, where we are being attacked by these pathogens, and our own commensal good bacteria, and of course our own white cells, our good immune cells, are working to get rid of them and keep them at bay. But if you don't have the right microbes in your mouth, then the bad guys can take over, and they create this chronic state of inflammation in the gums that causes the gum recession, and then you're in big trouble as your gums keep receding. And people can actually say, I'm doing everything right. What's going on? Well, even just brushing your teeth, and better than me, doesn't necessarily fix the problem, because you need the right microbes. So you want to somehow, and this is a whole area of extreme interest of mine, and I love looking at research, creating probiotics just for the mouth, or how can we restore the microbiomes of the body that have been disrupted because of hormonal imbalances, lots of antibiotics that are given, chemical toxins that are in toothpaste, for example, that are designed to kill. The problem is that they're killing the good guys along with the bad guys. So you end up with an imbalance, and we have to have a better way of reestablishing microbiomes other than trying to constantly kill, because it's indiscriminate killing. We can't just kill the ones we want. So it's the mouth microbiome is so important for the health of the gums. Now, as well, estrogen is very important for bone health. So the jaw, for example, is a bone. And we know that when women get more osteoporosis or even osteopenia as they age, because estrogen is so important for bone health, that a lot of doctors put them on these drugs that basically prevent bone turnover. So the bone is a living dynamic tissue, and there are immune cells. These are modified macrophages. They're part of our immune system called osteoclasts, and they're designed to gobble up old bone. And then there are special cells called osteoblasts that lay down new bone. And it's a dynamic system that's always in balance, except when you don't have enough estrogen, because estrogen regulates the immune system and helps to prevent that chronic low-grade state of inflammation. Well, chronic inflammation is related to activated osteoclasts. So you get this overabundance of active osteoclasts, these modified macrophages, and they over-gobble up the bone. And then you have an imbalance between laying down a bone and gobbling up a bone. But the solution isn't to kill or paralyze your osteoclasts, because essentially then you have no mechanism for gobbling up old bad bone and then laying down new fresh bone. So over time, you end up with, when you're on these drugs, with a jaw that becomes dense but fragile. So I know that it can even crumble if you try to do an implant, because I know most dentists are really averse to trying to do a lot of procedures on women who've been on these drugs for many years, because their jaw has been altered. Well, even without these drugs, the bone without estrogen is going to become more porous and more fragile, and you're going to lose proper implantation of the teeth into the jaw. So you're going to have recession of your gums, you're going to have altered bone, so the teeth become loose, and then they fall out. So women have high rates of tooth loss from aging in the menopause when they don't have the right estrogen. So to me, that alone is a reason to be on hormones, because who wants to be toothless with an inflamed mouth? And now we know that there's a huge connection between oral health and cardiovascular health. And in fact, they've actually cultured the oral bacteria that are pathogens, the bad ones that they get into the bloodstream. Why would anyone think they can't get into the bloodstream? Well, they do, and they can circulate. And of course, our arteries are what hold our blood, right? So they can actually, when you have unhealthy artery linings, which goes along with unhealthy metabolic states like menopause and PCOS, you end up getting the bacteria can actually implant into the artery walls and then incite more inflammation, and more macrophages come in, and then you end up with this whole inflammatory process going on in your artery wall. And they've actually shown that there can be bacteria from the mouth seeding. And we know that checking for oral health is very important for cardiovascular health. So the mouth in the conventional medical world is so underappreciated for its importance. We know that when people can't eat, just this alone, when people can't chew food properly because their teeth are loose or they're falling out, they will not eat properly, and they're not going to eat the right foods. And that's a huge problem because nutrition, people have forgotten why they eat. It's not just pure entertainment, it's real. I had to go to dictionary.com to look up food, because I would go to airports and I'd see people putting things in their mouths, and it's like, I don't think that meets the definition of food, and it didn't. Okay, so food actually has to have nutritional value, and people eat stuff that has no nutritional value. So technically, it is not food. So, and that is a big problem. But even if you want to eat healthy food, if you can't chew, you're going to have a very, very limited diet, and that's a huge problem for a lot of the elderly. So, my goal is to prevent all of this and to enjoy and to have teeth in your mouth for your whole life. And that is so key as well. And we know that when you don't have the right gut microbiome, when you have acid reflux, when you don't have the right mouth microbiome, you're also going to have dental decay, right? So you're going to have all of those unfortunate caries and the cavities forming. So, and that's the ticket to also ending up with root canals and crowns and all this stuff that keeps dentists so busy, because mouths are in such disarray these days.
Dr. Gersh, I've just had this vision of you lecturing this topic to rooms of dentists. This needs to happen. There needs to be this great kind of understanding of how hormones affect, the hard and soft tissues, the microbiome. It's so great that you've kind of gone into all this different research to put it all together like this.
Yeah, well, I'd love to.
It's going to happen. I'd like to we're running towards the end now. Can we quickly just summarize your position on HRT as you published in the British BMJ?
Well, I want to change the paradigm from, if you're going to give hormones, the old paradigm was give the smallest dose for the shortest time just to suppress the worst symptoms like night sweats and hot flashes. Change it completely to give the most efficacious dose for the entire lifetime to maintain the health and function of every organ system in the female body. And that is a huge paradigm shift. That is not accepted by the mainstream at all. There is right now no organization that is actually advocating for hormones to be used in that manner. The North American Menopause Society came out and said, under supervision, women can use hormones if they want for suppression of symptoms. So that's good for bone health, because that's the only one that the FDA has even recognized as being beneficial, in terms of effects from hormones. And the last one, which was sort of a clever idea, is quality of life. So at least now I have the blessing, so to speak, or at least not the sanction, to give hormones to women who want to have them, which more women will want when they understand the benefits and stop being afraid of it, that I can give it for the entire lifetime of a woman. So that came out in 2017. And so that was a blessing as far as I was concerned. But my goal is to educate, take away the fear, and use the science to help explain, why hormones are so important. And yes, I am completely honest. Menopause is natural and it's universal. And we want the menopausal years of a woman, which could be half of her life, to be high quality, wonderful years. But women who statistically as a group live longer than men live with many more chronic diseases than men do. And this is not well appreciated or recognized, that women have more of almost everything. They just happen, because we have those good X chromosomes, we happen to be able to survive longer, but women often have very poor quality of life. They have so much pain that they live with and so much sadness, and that is not the goal. It's about healthy longevity, not just longevity for its own sake. And by helping doctors to understand, which I hope will come out of the article in the British Medical Journal Heart, to help them to understand that hormones, when you give them in physiologic doses and use human identical hormones, that they can help the cells of the body in every organ to maintain their proper function, so that the woman's health can stay as optimal as possible. We're not going to maintain the health of a 25-year-old. We can't give back ovaries, but we can create a better state of health for every woman. And the earlier the hormones are started, the better it is, because trying to reverse disease is so much different and maybe not attainable than preventing itself. And I think we learned that from Humpty Dumpty.
Dr. Gersh, is such a powerful statement. Just before we finish off, can you give the listeners a bit of an idea as to how you go about your patient treatment? What does it look like to walk into a clinic, and what kind of things are you thinking about when you see these conditions like PCOS in your patients?
Oh, well, I love information. So I do a lot of lab testing. So both in my menopausal women and my Pcos patients, I want to know their state of inflammation, their nutritional status, their hormones, whether they have autoimmune disease or autoimmunity. So autoimmunity means that they have like a positive ANA, or they have positive antibodies, like for thyroid antibodies. They may or may not actually have the criteria to be called that they have a disease, but we know that we can actually reverse this, which is not what conventional medical world does, but we can actually help to reverse autoimmunity before it becomes a full-blown autoimmune disease. So I want to know, there all of these different things. So I love getting lab tests. For women who have cardiovascular risk, in my office, I have vascular scans. So I can actually look at the state of the intima of the arteries. I can see how much plaque is coming. And we know that the conventional world does not endorse that, because they say, unless you're going to do like stenting of the carotid arteries or an endarterectomy where you're like a roto-rooter, why would you bother knowing? Well, because I want to be proactive. I mean, it's like, why would I wait to know that somebody has end-stage disease? I want to know early on if they are on that path, so I can take proactive measures to prevent end-stage disease. And it's so ridiculous that our conventional world is so reactive. I am very proactive. So I want to know the state of the vascular system for my menopausal women in particular, and some of my older PCOS patients, my Pcos patients, I would like to get an echocardiogram, because we now know that estrogen deficiency, which is very important in terms of its effect on mitochondrial function, because we couldn't go into everything, but mitochondria, the energy producing factories of cells, depend on the presence of estradiol in order for their proper functionality. And you can't have a healthy anything if you don't make energy. And the heart, of course, is a very big user and creator of energy. And women's mitochondria don't work properly. So the heart actually develops a state of energy deficiency if you don't have enough estrogen from whatever the reason. And also we now know that estrogen metabolites, not only is estrogen important, but their metabolites, like 2-methoxyestradiol, that these metabolites actually, some of them have their own receptors in the heart and on the mitochondria to help prevent disease and heart failure and so on, and maintain optimal heart function. So I will look at the status of the heart with an echocardiogram. I have in my office a fitness specialist and a nutritionist. So it's so important, and this is not also done very commonly, but it's actually advocated for by the American College of Sports Medicine and the American Medical Association, and that is to do a fitness assessment. So I want to know, how fit are you? That's actually a vital sign of health. Are you strong? Do you have flexibility? Do you have balance? So there are actually tests that are created for every age group and gender to actually analyze the state of fitness. And then we do an exercise prescription, because fitness is actually a vital sign. We now know that it's as important as your blood pressure is what's your fitness status. And the most frail people are the most likely to die, more than high blood pressure. So we want to know fitness status. And as well, we do what is called we call it a reset. So we know that all of these people are going to have impaired gut barrier, dysbiosis of their gut, and often fatty liver and liver dysfunction. So we want to try to help restore gut barrier function. We want to help restore the gut microbiome and properly get the liver to work for it's the master metabolic organ and detoxifier of the body. So we get things started by changing the diet, by changing what they eat and when they eat, by giving targeted supplements to support liver function and gut health, and educate about exposure and limiting exposures to endocrine disruptors in household products and food products, and the importance of eating farm-to-table organic foods, and so on. So we deal with all of that. And then I have mind-body medicine, because we know that emotions and stress are very key to illness or health, depending on the status of your emotions and your stress control. So we do biofeedback, we do meditation, guided imagery. I have a wonderful bodywork massage therapist who understands the fascia, myofascial release, craniosacral massage. The musculoskeletal system has been so underappreciated in its role in health and healthy aging. So we want to make sure that everyone has a healthy fascia, good muscles, and they live hopefully without chronic pain. We know low back pain is incredibly prevalent and often can be repaired through proper posture, exercise, fitness, and getting those little knots or like the little fibrosis out of the fascia, so that the muscles are not going to be pulled any longer. So I'm bringing in an acupuncturist. I had one and she retired, but I have a new acupuncturist that will be starting shortly. So we try to look at the whole woman, the whole person. And we actually do see some men, smaller proportion than women, but because I'm double board certified in both integrative medicine and OB-GYN, I'm also qualified to see men. And a lot of my women patients say, can I bring my brother, my son, my husband, my father, or someone? Because we don't know where to take them anymore, because nobody's like paying any attention and these problems are cropping up. So, I do see the men who are referred by my women patients, and we, do a lot of work, and then I see the effects of their hard work and basically my education of them and surveillance and testing of them.
Dr. Gersh, thank you so much for spending an hour with us today. It's been so amazing to hear the depth of your knowledge, the way you've kind of gone into all these nooks and crevices to pick out this information. It's just absolute, and it makes so much sense when you lay it all out so well. So I want to thank you very much for that. And I'd like you to share with the audience where they can find you and what they can follow you on.
Well, I would love to. So I'm actually talking to you from one of my exam rooms, and I have a brick and mortar practice in Southern California, in Irvine, California. That's in Orange County, where I see patients every day. But fortunately, I can also do telemedicine. So for people who can't travel to Southern California, although we do have lovely beaches here and so on. And as well, I am trying to educate as much as I can with my Instagram Live. I try to do one every week. And that's at Dr. period. You got to put the period in, and Felice Gersh. So Dr. period Felice Gersh is my handle for my Instagram Live. And I do post on my Facebook as well. And my Instagram Lives go on to my YouTube channel. And I have a couple of books out, which I hope people will read. My first one is Pcos Sos. And that is a foundational book all about polycystic ovary syndrome. And my second book is Pcos Sos Fertility Fast Track. It's for women who really want to get pregnant and they want to do it right. So it's a week by week, 12-week program telling them exactly what to do to optimize their chances of being healthy and having good fertility and having a healthy baby. And I'm in the process of writing a book on menopause, kind of a what to expect when you're going into menopause kind of a book. And I hope to have more coming out after that. And that book will probably, I think the publisher wants to release it with the fall. So probably October, although it will be finished by the end of May. But I think it's going to be released in October. So you can look for that as well coming out. I don't have a title for it yet, but it's going to be on menopause because I love writing and educating. And it's just a question of finding time for all of these things.
It's difficult, and I just want to thank you for your time today, Dr. Gersh. Your work is just so inspirational, and I'm sure the readers are going to really resonate with finding out more about you. We'll have to do this again. I've got so many questions.
I'd love to.
Yeah, it goes so deep, and we're going to have to cover more.
Well, that would be my pleasure.
Thank you so much for joining me today. Have a good rest of your day, and we'll talk soon.